Bismillahirrahmanirrahim. Glycolipids metabolisms and their metabolic abnormalities. Glycolipids metabolism. Before we start, the glycolipids metabolisms included their synthesis and degradation. Let's review about its structure and brief introduction. Glycolipids are the derivatives of ceramides. Ceramides included sphingosine and fatty acids that attach with the sugar residues. These are also the essential components of all membrane in the body, but are found in a great amount in nerve tissues. They are located in the outer layer of plasma membrane where they interact with extracellular environment and plays a role in regulation of cellular interactions, growth and development. These are very antigenic. They also serve as a cell membrane receptors for cholera toxins and diphtheria toxins as well as certain viruses and microbes. Genetic disorders associated with an inability to properly degrade the glycosphingolipids can result in an intracellular accumulation of these compounds, leading to a serious impairment of the nervous system and development. Structure of glycosphingolipids is composed of a galactose, a polar head. They attach with the hydrophobic tail, consist of a ceramide which includes a sphingosine, amino group containing unsaturated fatty acid sphingosine. They attach with a fatty acid to make a ceramide that becomes the hydrophobic tail. Types of glycosphingolipids. Two types: neutral glycosphingolipids and acidic glycosphingolipids. Neutral glycosphingolipids, simplest neutral uncharged glycosphingolipids are cerebrosides, contains either galactose and glucose. They found predominantly in brain and peripheral nervous tissues with a high concentration in the myelin sheath of nerves. Now, acidic glycosphingolipids. Acidic glycosphingolipids, they are negatively charged at physiological pH. Negatively charged is provided by N-acetyluramic acid, NANA, which exists in gangliosides, or by a sulfate groups in sulfatides. Number 1. Gangliosides. These are the complex glycosphingolipids found primarily in ganglion cells and central nervous system. Contains one or more N-acetyluramic acids. Sulfatides. Sulfoglycosphingolipids, we called as sulfatides, are cerebrosides that contain a galactosyl residues that have been sulfated, negatively charged at physiological pH, found in nervous system. Now the synthesis of glycosphingolipids. Synthesis of glycosphingolipids occurs by sequential addition of glycosyl monomers transferred from sugar nucleotides donors to the acceptor molecule. Process takes place in the endoplasmic reticulum and Golgi complex. Enzyme involved in synthesis is glycosyl transferases. Glycosyl transferases, each specific for a particular sugar nucleotides and acceptor. Now the addition of sulfate group. A sulfate group is added to a galactocerebrosides by transfer from the sulfate carriers. The active sulfate carrier is 3' phosphoadenosine 5' phosphosulfate PAPS to the 3' hydroxyl group of the galactose by sulfotransferases. By sulfotransferase. Now the degradation of glycosphingolipids. Glycosphingolipids internalized by endocytotic mechanisms. All enzymes required for degradation process are present in the lysosomes which fuse with the endocytotic vesicles. These enzymes hydrolytically cleaves specific bonds in the glycosphingolipids, and they include alpha and beta galactosidase, beta glucosidase, neuraminidase, also called as sialidase, hexosaminidase, sphingomyelinase, sulfatase, we also call it sulfate esterase, cereminidase. These hydrolytic reactions are irreversible. Degradation is a sequential process following the rule last on and first off, with the last group added in the synthesis while the first group removed during the degradation. Now the sphingolipidosis. In a normal individual, synthesis and degradation of sphingolipids are balanced, so the amount in membrane remains constant. If a specific hydrolase required for the degradation process is partially or totally missing, sphingolipids accumulates in the lysosomes. Disease caused by these deficiency are called sphingolipidosis. Sphingolipid storage diseases results a neurological disorientation occurs that can lead to a early death. Common properties of sphingolipidosis: these are autosomal recessive disease except a Fabry disease which is X-linked chromosomes. Now the diagnosis of sphingolipidosis. A specific sphingolipidosis can be diagnosed by measuring the enzyme activity in cultured fibroblasts or peripheral leukocytes or by analysis of DNA. Histological examination of the affected tissues is also useful. Even a plasma or amniotic fluid for presence of enzymes activity and for accumulated lipids should also used. Now the metabolic disorders. These metabolic abnormalities are totally similar to phospholipids abnormalities. Metabolism of phospholipids abnormalities included the sphingolipid storage diseases, except number 9, Farber's disease. All are same. These include sphingolipid storage diseases. Number 1, Tay-Sachs disease, associated with a progressive development of blindness in infants soon after the birth due to a widespread separate injury to a ganglion cells, especially in cerebral cortex and brain and retina, and caused by a destruction of retinal ganglion exposing the underlying vasculatures, leads to a macrocephaly and mental deterioration. The enzyme deficient in this case is hexosaminidase A, and the storage substances as a ganglioside GM2. The Gaucher disease. Number 2. In infancy and childhood, early acute onsets with a rapid course and death in several years. Infants leads to a weight loss, failure to growth, progressive mental retardation is seen in adults, enlargement of spleen, splenomegaly, which may reach to umbilicus. Characteristics bone pain is seen due to a marrow cell replaced by histiocytes loaded with the lipids. As a result, it leads to a progressive anemia, leuko- leucop- leukopenia, and thrombocytopenia that may increase the tendency of to get the secondary infections and bleeding disorders. Bleeding tendency. Inherited disorders of cerebrocytes metabolism, autosomal recessive enzyme deficient in Gaucher disease, beta glucocerebrosidase, a lysosomal enzyme large amount of, of glucocerebrocytes accumulated in reticuloendothelial cells, liver, spleen, bone marrow, as well as in brain. Fabry's disease. Fabry's disease is the only X-linked dominant, more prominent in male, enzyme deficient alpha galactosidase, enzyme found in liver, spleen, kidney, brain, and small intestine, accumulation of cerebral trihexoside. Skin rashes, skin become reddish purple, pain in lower extremities, painful neuropathies, lipids accumulated in endothelial lining of blood vessels may causes a vascular thrombosis, progressive renal failure due to excessive deposition of lipids in glomeruli, cardiac enlargement is seen, eye involvement, corneal opacity is seen, cataracts, as well as vascular dilatation. Number 4. Niemann-Pick disease, an autosomal recessive disease caused by the inability to degrade sphingomyelin. The deficient enzyme is sphingomyelinase. Niemann-Pick disease further consists of two types, type A and type B. A severe infantile form less than 1% normal activities. Liver and spleen are the primary sites of liver deposits and thereby are tremendously enlarged. The liver consists primarily of sphingomyelin that cannot be degraded. Infants with this lysosomal storage disease experience a rapid and progressive monodegeneration as a result of progressive neurodegeneration is seen as a result of deposition of sphingomyelin in central nervous system and they died in early childhood. Type B, a less severe variant caused by a little to no damage to neural tissues, but lungs, spleen, liver and bone marrow are affected, resulting in chronic form of disease with a life expectancy into a childhood. Number 5. Globoid leukodystrophy, Krabbe's disease, in which the enzyme deficient is galactocerebrosidase A. The substance accumulated is galactocerebrosides. Krabbe's disease associated with a severe mental retardation, total absence of myelin in central nervous system. Globoid bodies found in the white matter of brain leads to a progressive dementia. Prognosis becomes fatal. Number 6. Metachromatic Leukodystrophy. Metachromatic leukodystrophy, the enzyme deficient is aryl sulfatase A and the substance accumulated is sulfatides. Mental retardation, nerves become stained yellow, brown with crystal violet dyed. As a late infancy type usually manifested before the 3 years of life. Gross involvement of central nervous system defect in locomotion, weakness, ataxia, hypotonia, paralysis, and difficulty in speech and difficulty in engulfs or difficulty in eating may be a optic atrophy is seen. Adult types initially associated with a psychiatric manifestation and progressive dementia. Number 7. Generalized gangliosidosis. In generalized gangliosidosis, the enzyme deficient is beta galactosidase and the substance accumulated is GM1 gangliosides. Disease generalized gangliosidosis is associated with a mental retardation, liver become enlarged, skeletal involvement. Number 8. Sander's-Jacques disease, in which the enzyme deficient is hexosaminidase A and B, substance accumulators is GM2 gangliosides as well as globosides. Signs and symptoms are same as Tay-Sachs disease and more rapidly progressing. And the last, Farber's disease, which is only exclusively seen in the metabolic abnormalities related to the glycosphingolipids. Related to the sphingolipids, painful, progressive deformed joints become more painful, become stiff. Subcutaneous nodule is seen. Fatal in early life. The enzyme deficient in Farber's disease is cereminidase. Cereminidase enzyme normally hydrolyze ceramide into a sphingosine and fatty acids. Due to its absence of cereminidase, ceramide is unable to hydrolyze into sphingosine and free fatty acids. Assignment. What do you understand by sphingolipidosis? Also enumerate the sphingolipid storage diseases along with their enzyme deficiency and storage substances. So that's all about metabolism of glycosphingolipids along with its abnormalities.